Welcome to another edition of the What is Global Health podcast. Today we'll be talking to Dr. Tang, a professor of environmental health sciences at the Columbia University Medical Center. His research focuses on developing predictive statistical risk models for cancers, particularly genetic susceptibility and environmental exposures. He also develops and validates biomarkers, and his modeling work includes possible interactions between genes and how genotypes are associated with environmental exposures and disease status. How you use statistical approaches to develop predictive risk models to help early cancer detection?
So to detect the cancer in early stage, we talk about in my work is chemical carcinogenesis. Now, in addition to chemical carcinogenesis, there's the radiations and also bacteria, virus may lead to cancer. That lead to different kind of cancer. So my work is focused on chemical carcinogenesis, and in particular, we are focused on environmental exposure. Mm-hmm. So at this moment, cancer is still a very challenging disease for our humanity because there is no cure at this moment. I think that's still a good definition. There's no cure for cancer. Now we can stop cancer or release some symptoms and make a lot of effort try to cure it, but it's still very difficult. One of the reasons is we lack of a mechanism. So we don't know what is the cause of cancer. But gradually over the years, we understand that cancer is a very long period of time process. So when we see a clinical stage cancer patient, this is in a very later stage of this cancer process. The cancer has about 10, 12 years latency period. Mm-hmm. So whenever you see a clinical stage cancer, a lung cancer patient today, it's related to the exposure she or he had about 12 years ago. So the cancer takes that long time to develop. So to detect the early stage of a cancer will win a lot of time for the clinical physicians to treat, to find a way to develop better regimens to treat, to cure cancer. But if you always find the cancer at the last stage, then actually you don't have the time to reverse the process. But see, for the long term, latency period, making the things is very hard to do. Mm-hmm. And also, on other end, cancer is not like previously we are the medicine working on a lot of those infectious diseases, which is oftentimes is a single agent. You detect that bacteria, you know that once that gets into the body, then you will get that particular disease. If you kill that bacteria, you solve the problem. And also you can prevent the bacteria getting into the body, then you can prevent the disease. But cancer is a multi-factor. It's not just only exposure, also related to your lifestyles, also related to your genetic profile. Yeah. So that's why you need taking this whole thing in together to see what is the best bet, what the mechanism is.
Can you please explain your research in bioinformatics?
Bioinformatics is a very powerful tool. It's a combination of math and the genetics and the biology together. So this is the way to dealing with those potential mechanisms, to testing those potential pathways and so on. So probably I just discuss how complicated is the cancer issues. So it's not trying to identify a single agent, a single factor can solve the problem. It's the consequence of multiple factors, multiple time points exposure, and also your genetic, which is what we call severability, and in combination. So you always hear somebody is complaining, saying, that guy is smoker, is a chain smoker. He lived to 90 years old. And that guy only exposed to some passive smoking, and he died of lung cancer in a very early stage. So why is difference? Because of the genetic profile, because the susceptibility. That guy is just more susceptible than others. So in our work, we focus on the most susceptible population, which is newborns. A newborn is not a smaller human being. It's an incomplete developed human being. So their defense mechanism, their susceptibility, their repair mechanism is not fully detected. And also, they are already, before they get into this world, get delivered, when they're in the womb, in mother's womb, they already receive some of those exposure by mother's exposure. So that's why we are focused on the newborns. So we have several cohorts developed in Manhattan, also developed in Poland, developed in China. So testing, follow up those cohorts, see, what's the impact on those exposures, very early stage of life, and follow them up, and what are the impact in terms of their physical development, in terms of their neural development. So what we do is we try to encourage the government to go in the right direction. So we've identified a city called Chongqing, and the name of Chongqing is nearby the Three Gorges Dam. And we went through many of those counties. We finally find one of a small town outside Chongqing, the city called Tongliang. The Tongliang was a textile industry. Unfortunately, in the middle of the downtown, there is a thermal power plant. The thermal power plant built a long time ago. It's very outdated and emitted tremendous pollution, the dusts and so on. Why in the middle of downtown? As we said earlier, there was a textile industry, so they are not just need power, electricity. They also need steam. So you have to build a thermal power plant in the middle of downtown to provide the steam for the industries. But now the textile industry is gone, and the thermal part of the power plant, they don't function anymore. They don't need to provide any steam anymore, but they still produce electricity for the people who live there. But also trying to reduce the cost. So they're using local coal, which is very, very high in sulfur and very high in ashes. So that is a quite ideal situation for us. And we work with the Chongqing municipality, work with the local government to try to make a plan to shut down that power plant in the middle of downtown. And in the meantime, we have set up our environmental monitoring system. Before they shut down the power plant, we recruit a pregnant woman in the 2-kilometer radius of the town, and then we're collecting all the biological materials, the placenta, the urine, and so on. And also we did a quite extensive environmental questionnaire to ask them where they live, what kind of fuel they're using for cooking, what kind of fuel they're using for heating, and where they work, and how far are they from the power plant, and so on. Then we're waiting for the power plant to close, then we can collect in the second cohort. Finally, they closed 2004. So we collect our second cohort same as the first cohort. So we have 2 cohorts apart of 2 years, But the major difference is one is the pregnant and during the power plant still operating, and another cohort is the pregnant after the power plant was shut down. So we follow those kids for 5 years. We compare their physical activity, physical development, and the neural development, and also we're using our molecular epidemiology approach, which is making a lot of internal biological changes in terms of DNA damage, in terms of genetic profiles. So we put in our model. We clearly see there is a significant difference, or what we call benefit, to shut down the power plant. So the consequence is we try to publish many papers. The conclusion is better policy, cleaner environment, healthier population.
So have you extended your findings in Tongliang to other cities?
In 2008, we start to getting enlarge our work we did it in Tongliang. So we went to Taiyuan. The smog is so heavy, and even the sun shining day, but you cannot see the sun. The government to work with Asia, Bank of Asia, and work with the European Union. The European Union sent a team of Norwegian scientists to Taiyuan to help them to develop more effective policy based on the scientific data. If you base on the scientific data to make more targeted, more effective environment policy, the environment pollution can be improved. Then once you're cleaning the environment, then the population health well improved. And not just for short term, also for the long term. And in the meantime, when we do the analysis, we also monetize, seeing how much money they saved. So we're looking to the health costs on the premature deaths. That one item alone, there is 44 billion for Taiyuan municipality over 10 years. But if you're looking for the health costs in terms of hospital, the number is tremendous. You have a better environment. It's better for your economic development. You can save money in many, many areas. And for long run, you save big time. So that was our work in China, and we did a similar work in Manhattan. We did a similar work in Poland.
Yeah, and it's good to have this research evidence to help support these policy changes. It's very important to find this kind of evidence.
So we had one international conference. We hold one international conference in Taiyuan in 2013, which is well attended, is getting well covered by the Chinese media and also worldwide. And then after our 2013 conference, and just happening, the smog situation get worse in Beijing and other major cities, and also the U.S. embassy started to provide PM 2.5 data on the internet. So it gave the government additional pressure. So actually, government made a lot of new policies try to reduce the pollution. So then this time I went to Beijing. What I was thinking is now is a time to summarize everybody's effort trying to improve our environment. So what is the successful stories? What is the lesson learned in the process? So those cases can be shared with the rest of the world. This time when we go to Beijing is inviting all the environmental scientists, the lead of environmental scientists, and also those major government officials, and we're putting a small workshop and discuss how do we organize the second environmental international conference in Beijing, will happen this year in September. So the consensus is it's very necessary to have this conference to improve the dialogue between different discipline areas. The U.S. Embassy in Beijing was very supportive. WHO is very supportive, and the Chinese government and the major universities such as Tsinghua, Beida, Renda, they all very supportive and attend this conference. So at this moment, we are actively put those conference forward to anticipate in the September of this year to have in Beijing, and to have worldwide scientists, environmental health scientists that come over to discuss, to learn from each other, to share the latest technologies and the science development.
So this is a wonderful opportunity to synthesize all the work and to brainstorm more ways to improve these environmental factors.
Yeah. So if there is a good example, the rest of the world should know. They should know you don't need to go through those again. Here is a good example you can follow. And here is a bad example. So next time, don't go that way.
Definitely. So thank you so much for your time, and we look forward to following more of your current and future work.